There is a simple test you can do right now in your own home that takes less than 5 minutes and requires no equipment. Doctors and physical therapists use variations of it to assess functional strength and fall risk in older adults. Researchers have studied it extensively, and most people over 70, including many who consider themselves reasonably active, struggle with it more than they expect. That gap between expectation and reality is not a minor detail. It is precisely the kind of information that changes what you do next. The test is called the 30-second chair stand. You sit in an ordinary chair, stand up, sit back down, and repeat as many times as you can in 30 seconds. No armrests, no pushing off your thighs, just legs, core, and whatever the lower body can produce on its own. Most people assume they will do fine. They walk regularly. They feel reasonably strong. They do not have a diagnosed mobility problem. So they sit down, start the timer, and discover somewhere around repetition 6 or 7 that their legs are asking a serious question their confidence never anticipated. Here is the thing. The struggle is not a failure. It is data. And in this video, you are going to understand exactly what that data means, what physical systems this test is actually measuring, why those systems are the ones that most determine independence and fall risk after 70, and a practical 5-step approach to strengthening them that you can begin this week. We will also look at what your specific score may indicate and when a particular pattern of difficulty deserves a conversation with your physician. One of the 5 steps near the end addresses a component of leg strength that almost no one focuses on after 65, and it turns out to be the component most directly connected to preventing the kind of fall that happens not during exercise, but during an ordinary afternoon at home. Before we get to the test itself and what it measures, it is worth establishing why lower body strength in the 7th decade and beyond carries such significant implications. Independence in daily life, getting up from a chair, climbing stairs, walking through a parking lot, stepping in and out of a car, reaching a bathroom safely at night, depends on the legs. Not the cardiovascular system alone, not general activity level. Specifically, the muscular strength and neuromuscular coordination of the lower limbs. When lower body strength becomes insufficient for these tasks, the consequences are not gradual inconveniences. They tend to arrive as events: a fall, a hospitalization, a period of immobility that further reduces strength, a loss of confidence that restricts activity, a restriction of activity that further reduces strength. That cycle, once started, is difficult to interrupt. What makes this particularly important is that meaningful lower body strength loss can be underway for years before it becomes visible in daily life. The body is remarkably good at compensating, using momentum, using surfaces, changing technique, until the reserve drops below the threshold that compensation can cover. By that point, the conversation has changed from prevention to rehabilitation. This video is about the earlier conversation. A brief but important note before we continue. If you have a recent hip or knee replacement, active joint inflammation, a history of severe osteoporosis with fracture risk, or significant cardiovascular disease that limits exertion, please speak with your physician before performing the chair stand test or beginning any new movement program. What follows is designed for adults with generally stable health who want to understand and improve their functional lower body strength. It is educational, not a personalized clinical program. The 30-second chair stand is not simply measuring how strong your legs are in the way a weight machine might. It is measuring several overlapping systems simultaneously, which is precisely why it is clinically useful, and precisely why understanding what those systems are gives you a framework for what to do about your score. System 1. Quadriceps strength and endurance. The quadriceps, the large muscles along the front of the thigh, are the primary drivers of the standing up movement. Every time you go from seated to standing, the quadriceps must contract to extend the knee against your body weight. In the chair stand test, they do this repeatedly over 30 seconds, which tests not just maximum strength, but the ability to sustain moderate strength output over time. After 70, quadriceps strength is one of the most reliably declining physical capacities. Muscle tissue is gradually replaced by fat and connective tissue through a process called sarcopenia, age-related muscle loss, and the quadriceps are particularly affected because they are one of the largest muscle groups in the body. The good news is that they also respond meaningfully to training at virtually any age, including well into the 80s. The chair stand is essentially a repeated bodyweight squat, which means it provides a direct, functional measure of whether the quadriceps can handle the demands of ordinary daily life. The chairs, the stairs, the car seats, the floor. System 2. Hip extensor power. The quadriceps get most of the attention in discussions of leg strength, but the gluteal muscles, particularly the gluteus maximus, are equally important to the standing movement, and are often more significantly declined in older adults who spend considerable time sitting. The hip extensors drive the body upward from a bent hip position. In the chair stand, they work alongside the quadriceps to complete the movement. When the gluteal muscles are weak or inhibited, a pattern common in people who have been predominantly sedentary, the body compensates by leaning the trunk forward excessively, pushing off the thighs, or using the armrests. These compensations work in daily life at a certain level, but they are also signals that the posterior chain, the muscles running along the back of the body, is not contributing its share. This matters beyond the chair. The hip extensors are critical for stair climbing, for propulsion during walking, and for the rapid corrective movement required when balance is suddenly disturbed. System 3. Neuromuscular coordination and transition speed. Each complete sit-to-stand-to-sit cycle requires the nervous system to coordinate a timed reversal of muscle activation, from the muscles controlling the descent to those driving the ascent, and then back again. This rapid alternation places demands not just on muscle strength, but on neuromuscular coordination, the speed and accuracy with which the nervous system organizes muscle timing. After 70, neuromuscular coordination declines alongside muscle mass. Movements become slightly less crisp. The transition from one phase of a movement to the next takes fractionally longer. Under low-demand conditions, this is not noticeable. Under the repeated, moderately fatiguing conditions of the chair stand test, it becomes apparent in the score. Think of it like a production line that runs fine at slow speed, but begins losing efficiency as the pace increases. The individual workers, muscles, may each be capable, but the coordination between them introduces the limiting factor. This component is trainable, and it responds particularly well to practice that includes both the upward and downward phases of the movement, with deliberate attention to each. System 4. Balance during transition. The moment of transition from seated to standing, when the body's weight shifts from the chair to the feet, and the center of mass travels upward, is one of the highest balance demand moments in ordinary daily life. It requires the balance system to manage a rapidly changing center of gravity with limited base of support. In the chair stand test, this transition happens repeatedly. Each repetition is a small balance challenge. When balance is compromised, through reduced proprioceptive sensitivity, reduced ankle stability, or reduced hip strength, the body again compensates. It slows down, it widens the stance, it reaches for the armrests. These compensations reduce the test score, and they are exactly the same compensations that make ordinary chair rising feel more effortful and precarious than it used to. Here is how to perform the 30-second chair stand accurately. Choose a firm, straight-backed chair with a seat height of approximately 17 inches. A standard dining chair works well. Place it against a wall or in a stable position so it cannot slide. Sit toward the front edge with your feet flat on the floor, hip-width apart. Cross your arms across your chest. Set a timer for 30 seconds. When the timer starts, stand completely upright. Do not stop at a halfway position, and then sit back down with control. Do not bounce off the chair or use momentum. Repeat as many complete stand and sit cycles as you can in 30 seconds. A complete repetition requires full standing, knees and hips extended, and full sitting, with the weight returning to the chair before the next repetition begins. Partial repetitions do not count. Count your complete repetitions. For general reference, which comes from widely used functional fitness norms for older adults, adults in their early 70s typically perform somewhere in the range of 12 to 17 repetitions. Adults in their late 70s typically perform in the range of 11 to 16. These are approximate reference points, not diagnostic cutoffs. Individual variation is substantial, and factors including height, weight, joint health, and prior activity level all influence the number. What matters more than the absolute number is how the movement felt. Did you need to use your arms at any point? Did one leg feel significantly weaker than the other? Did you feel unsteady at any point during the transition? Did you stop before 30 seconds because of leg fatigue rather than simply running out of time? Those qualitative observations are at least as informative as the number itself, and they point toward specific components of the 5-step strengthening approach we are about to cover. The 5-step approach to building stronger legs. After 70. Before beginning these steps, here is a practical question worth considering. Which of the 4 systems described above, quadriceps endurance, hip extensor strength, neuromuscular coordination, or balance during transition, felt most limited during your test? That observation helps you prioritize. All 5 steps matter, but starting where your gap is largest produces the fastest, meaningful improvement. Step 1. The slow chair stand. This is the foundation, the movement most directly aligned with the test and with the daily life demands that matter most. The standard chair stand, done repeatedly at a moderate pace, builds quadriceps endurance and hip extensor strength simultaneously. But the version that produces the most benefit, and the version most people skip, includes a deliberately slow descent. Sit toward the front of your firm chair, arms crossed over your chest. Stand up with deliberate effort. Do not use momentum, but do not go slowly on the upward phase. Then sit back down, taking 3 to 4 full seconds to lower yourself. Feel the front of your thigh working against gravity throughout that controlled descent. That is eccentric quadriceps work, the muscle lengthening under load, and it is one of the most potent stimuli for building functional leg strength in older adults. Begin with whatever number of repetitions represents a genuine but sustainable effort. For many people starting this practice, that is 5 to 8. The controlled descent is more demanding than most people expect, and the quality of the slow lowering matters more than the total number of repetitions. Practice this on at least 4 days per week. Over 4 to 6 weeks, most people notice a meaningful change in how the chair stand test feels. Step 2. The standing hip hinge. This step addresses the gluteal muscles and posterior chain, the component that often goes unaddressed when people focus only on the quadriceps. Stand behind your sturdy chair, holding the back lightly for balance support. With soft knees, not locked but not deeply bent, push your hips backward as if you were trying to touch the wall behind you with them, while keeping your back relatively flat. Your torso will tip forward. Then drive your hips forward to return to standing, squeezing the glutes at the top. This is a simplified version of a hip hinge, one of the most fundamental movement patterns for posterior chain activation. It targets the gluteus maximus, the hamstrings, and the lower back muscles that together constitute the hip extension strength that powers the standing movement. Many older adults have reduced gluteal activation from years of prolonged sitting. The muscles are present, but the nervous system has somewhat deprioritized their recruitment. The standing hip hinge begins the process of reestablishing that recruitment pattern, and over time this translates directly into a more powerful, more secure standing movement. 10 to 15 repetitions, 3 to 4 days per week, is a reasonable starting dose. Step 3. The step up. If you have access to a single step, a stair, a low platform, or even a stable step stool, this exercise addresses the most functionally relevant application of lower body strength. Managing your own body weight on one leg at a time. Step up onto the surface with one foot, then bring the other foot up, then step back down leading with the same foot, then the other. Alternate the leading foot with each set. The step up trains the quadriceps and hip extensors under single leg load conditions, which is much closer to what the legs actually do during stair climbing and during many ordinary movements than double leg exercises are. It also places significant demand on the stabilizing muscles of the hip and ankle, training balance during functional movement simultaneously. Hold a wall or railing initially for safety and confidence. The goal over time is to reduce reliance on the support as the movement becomes more automatic. Start with whatever step height is comfortable and manageable. A 4-inch rise is appropriate for many beginners, and progress gradually. Step 4. The chair stand pause. This step specifically targets the neuromuscular coordination component, the transition speed and timing that the chair stand test challenges. Perform the chair stand movement as described, but pause for a full 2 seconds at the top, fully standing, arms still crossed, before beginning the descent. During that pause, notice where your balance is. Is your weight centered over both feet equally? Are you holding your breath? Is there any sense of instability? That 2-second pause at full standing is a balance and coordination checkpoint. Over time, it trains the nervous system to manage the transition more efficiently, because it interrupts the tendency to rush through the movement using momentum rather than controlled muscle recruitment. It also gives you valuable information. If the pause consistently feels precarious, that is a signal that the balance component of this movement deserves specific attention, separate from strength work. Practice this as a modified version of your chair stand sets 2 or 3 times per week, slower with the pause, rather than for maximum repetitions. Step 5. The single leg weight shift. This is the step that addresses the component most directly connected to fall prevention during ordinary daily activities, and the one most people have never heard of as a strengthening exercise. Stand beside your sturdy chair or a counter for safety. Shift your weight gradually onto one leg, lifting the opposite heel just slightly off the ground. Not a full single leg stand, just a weight shift. Hold for 3 to 5 seconds, feeling the standing leg working to maintain stability. Then shift back to equal weight and repeat on the other side. This movement trains the hip abductors, the muscles on the outer hip, along with the ankle stabilizers and the neuromuscular systems responsible for rapid weight transfer. When balance is unexpectedly disturbed, the first corrective response the body produces is a rapid weight shift onto the more stable leg. If that movement system has not been practiced, the response is slower and less effective. The single leg weight shift is not dramatic. It does not look like exercise. People are often skeptical of its value until they try it and discover that even the partial weight shift is noticeably demanding on the stabilizing muscles. That demand is the signal that it is addressing a gap. 10 repetitions on each side, 4 days per week. Within 3 to 4 weeks, most people notice reduced effort during ordinary weight shifts, stepping off a curb, reaching into a cabinet, pivoting in a small kitchen space. Your action plan. Where to begin? Here is what to do this week. On the first day, perform the 30-second chair stand test and record your score and your qualitative observations. Use a firm chair, arms crossed, timer set. Write down the number and note which moment felt hardest: the standing, the sitting back down, or the later repetitions when fatigue was building. On the second and third days, begin with step 1, the slow chair stand, on its own. Focus entirely on the quality of the controlled descent. Do not rush. Do not worry about repetition count. Build the habit of the movement before building volume. In the second week, add step 2, the hip hinge, on alternate days from your chair stand practice, or at a different time of day if that suits your schedule better. Keep each session brief. 15 minutes total, consistently 4 days per week, is more productive than 2 exhausting 40-minute sessions per week. By the third week, incorporate step 3 or step 4, depending on what your test observations suggested was your primary limitation. If the neuromuscular transition felt disorganized, prioritize step 4. If single-leg activities felt weak or precarious, step 3 is your priority. Step 5, the weight shift, can be incorporated almost anywhere. Practice it while standing at the kitchen counter, while waiting for the kettle, while watching something on television. Because it requires no setup and no equipment, it is the easiest of the 5 to build into daily life as a background habit rather than a formal exercise. Retest yourself at 4 weeks. Not to compete with anyone or achieve a benchmark score, but to observe your own progress. Most people who practice these 5 steps consistently for a month notice a meaningful difference, not just in the test, but in how chairs feel, how stairs feel, and in the general quality of confidence during everyday movement. If you notice during the test or during any of these exercises that one leg is significantly weaker than the other, that you experience pain in the hip, knee, or ankle during the movement rather than simple muscle effort, or that your balance feels substantially impaired, those patterns are worth discussing with your physician. A referral to a physical therapist can provide a personalized assessment and a progression tailored to your specific history. Lower body strength after 70 is not a fitness goal in the conventional sense. It is a functional reserve. It is the margin between what your legs can produce and what daily life demands of them. When that margin is generous, ordinary activities feel easy. Getting up from any chair, in any setting, feels unremarkable. Stairs are just stairs. A misstep on uneven ground is something you recover from, rather than something you fall from. That margin is invisible when it is adequate, and very visible when it is not. The chair stand test makes that margin visible in 5 minutes. Not to alarm you, but to inform you, to give you an accurate picture of where the reserve currently stands, and what specific systems would benefit most from attention. The 5 steps described here do not require a gym, a trainer, or special equipment. They require a chair, something stable to hold for safety, and about 15 minutes 4 days a week. They are not a complete fitness program. They are a targeted response to the specific physical systems that determine functional independence in the decade and beyond. If this kind of clear, mechanism-based explanation is useful to you, subscribe so you do not miss what comes next. And share this video with someone over 65 in your life, particularly someone who mentioned recently that stairs are getting harder, or that getting up feels more effortful than it used to. They may not realize how directly actionable that pattern is. In the next video, we will look at why grip strength, the strength of the hand and forearm, turns out to be a reliable indicator of overall body strength and health in older adults, and what changes in grip strength over time may suggest about the broader physical systems that deserve attention. If that connection sounds surprising, it will make complete sense by the end. The margin between capability and daily demand is worth measuring, and it is worth maintaining. You now have both a test and a starting point.